Next question in my grief Q&A series. The person said they have a lot of death anxiety, and they asked me, as someone that's lost both her parents and her sister, if I have death anxiety. They also asked if they should go to therapy because it makes them feel like they aren't living freely because they're so focused on that death anxiety. So I'm not a therapist, but I did recently interview Dr. Robert Smith, who is a doctor, a mental health advocate, and author. Asked him this question because I think it is an important question for people that are grieving to know when you need extra help. And he said that if you feel like you can't do basic things, you can't live normally, issues whether under eating or overeating, you're having trouble sleeping, you're having trouble just like doing daily tasks, then he recommends you should go talk to somebody. And that's the advice that the doctor gave, so that's what I'm going to say here. In terms of death anxiety, my dad passed in 2014, my sister passed in 2016, my mom passed in 2018. They didn't pass 2 years exactly in between each other, but like the years were 2 years. I did think in 2020, I was like, is this like a family curse? Is something gonna happen? But it wasn't at the forefront of my mind, but probably because I experienced so much loss that like, I was dealing with a lot that, yes, I thought about it, but it wasn't like my first thought. It's not personally something I deal with. I've lost my sister, my mom, my dad. It's like I've dealt with really hard things. I'm more focused on living and living a good life and figuring out what that takes. So if you feel stuck in your grief, if you feel that grief is taking over, then Dr. Robert Smith does recommend going to talk to somebody and just seeing what they recommend and what your options are.